Hi, I'm Dr. Blane Sessions with the Philadelphia Hand Center in association with the Crozier Keystone Health System. I'm here to talk about pumpkin carving tips. Here today we have Caitlin. Wave to the camera, Caitlin. She's going to help me do some pumpkin carving today. We just want to talk to you about some tips and ideas to prevent injuries to the hands and fingers this year. We're going to talk about what type of pumpkin to have. You want to have a nice medium-sized pumpkin. The lighter the color, the actually easier it is to cut. The darker the color, the little bit more difficult it is to cut. We've got our instruments here. We have a serrated knife here. We also have gloves, and we have markers. So we'll go over some of the things to make everything safe.
That's the right hand.
So yes, that's the right hand. What we'll do is we'll talk about you want to have a clean, well-lit area that's free of debris and clutter. So we'll kind of move this out of the way.
Okay.
Okay. And we're going to leave the carving to the adults. The adults have a little bit better hand-eye coordination than someone like Caitlin. Although Caitlin's very, very talented, she's going to be drawing on the pumpkin, drawing shapes and patterns that she wants to have carved. Okay, now Caitlin's here. She's gonna draw some shapes and patterns that she wants.
Can I draw mouth and eyes now?
You can draw the mouth and eyes. So a good thing is to have your kids or young kids, the children, to draw out the pattern and shape that they want. This allows them to be interactive, be a part of the pumpkin carving, while staying away from the sharp instruments like the knives and cutting instruments. So Caitlin's here drawing a mouth, a very nice mouth with teeth. So this will be cut out for her by an adult. So Caitlin here is drawing a mouth and eyes. This is a perfect, nice job, Caitlin. This is appropriate. So the next step will be after your child has drawn the object that they want, it'll be for the adult to do the cutting and those sorts of things. Caitlin here is drawing our areas that she wanted cut. So I've cut it for her. I've used a serrated knife. A serrated knife is a little bit better than a flat, sharp knife. It's less likely to get lodged into the pumpkin and get cut. Serrated knives actually cut the pumpkin better. So we've done that. We've also cut the top. We've opened the top here. And a helpful hint is to use an ice cream scooper, or we have a little cup scooper here, to scoop out the inside content so that your hands don't get all greasy. Here Caitlin is putting stickers onto the pumpkin. This is a great way to have kids detail a pumpkin versus cutting a pumpkin for pumpkin carving. This allows her to interact with the pumpkin and have fun without actually having to carve. Well, the adult's already done the carving for her. There's also, she's drawn some mustache here and some eyebrows and those sorts of things. If you do cut yourself, most injuries are superficial and require a trip to the emergency room for a washout, possibly antibiotics, and then some suturing. Or if it is deeper or more severe, then they will call a consultant that will come in and evaluate you. Common injuries to the hand include superficial lacerations where you have just bleeding and those sorts of things. Others include that would be deeper, would be nerve injuries or tendon injuries that would need to be seen by a specialist. For more information, please contact 855-5-CK-HAND for a hand surgeon in your area. And we want to wish everyone a very happy Halloween. Say Happy Halloween.